Gardens enhancement project are extremely important.
For us, agriculture education programs not only teach students how to be farmers, but it also trains tomorrow's scientists, the nutritionists, and so much more. A combination of classroom instruction and applied agricultural experience outside the classroom that seeks to build the foundation for an educated consumer populace and agriculture.
The ministry handed over agriculture starter kits, including tools and seeds, to the schools participating in the initiative. Washington Archibald High, Charles E. Mills Secondary, Verchilds High, Keon High, and Beach Allen Primary. The Schools Gardens Enhancement Initiative falls under the Agriculture Education Initiative and forms part of the ministry's week of activities to commemorate World Food Day. Citizens of St. Kitts and Nevis are invited to submit applications for scholarship opportunities to pursue higher technical and vocational education in Morocco for the academic year 2021-2022. A total of 20 scholarships are available. Successful candidates will be required to attend French classes at Alliance Française before departing for Morocco. All applications should be submitted to Jamila Adams at the Human Resource Management Department at Government Headquarters on Church Street. The submission deadline is October 22nd, 2021. For more information, contact the Human Resource Management Department at 467-1323 or the Ministry of Foreign Affairs at 467-1158. Regionally, statistics from the Pan American Health Authority show that Jamaica is among 5 other Caribbean nations to have less than 20% in vaccination take-up. Prime Minister Andrew Holness says it is not the government's intention to force citizens into taking the COVID-19 jab. But in order for the economy to be fully reopened, it is crucial to have a high vaccination rate. More in the CVM Live news report.
According to Prime Minister Andrew Holness, the government is moving in the direction of providing more options as it relates to vaccine availability. PM Holness notes new tactics will eventually be implemented by the government in regards to the handling of the pandemic.
Eventually, not in a long-term perspective, but in the very near future, the government will change its tact in how we have managed the pandemic.
Mr. Holness recognizes that people have been frustrated with the tightened restrictions. He says taking the necessary precautions will in the interim safeguard livelihoods in the long run.
What we are urging all Jamaicans to do is to protect yourself against the eventuality, the possibility of getting infected. And if you get infected, against the probability that it would be serious to the point of death, and to protect your economic well-being.
Speaking at the Pan American Health Organization's weekly press briefing, PAHO's director, Dr. Carissa Etienne, highlights Jamaica is among 6 countries in the region yet to reach 20% vaccination. She further notes that these countries have been grappling with vaccine inequity, adding these nations are also facing internal issues.
In Jamaica, supply delays have gotten in the way. In Guatemala, shortages of syringes have delayed immunization campaigns. In Haiti, logistical challenges continue to delay the rollout of available doses. And across the Caribbean, vaccine hesitancy among some groups remains a problem.
Javine McLean, CVM Live.
And finally, in regional news, St. Lucia's opposition United Workers' Party has criticized the rules, regulations, and laws underpinning the recently rolled out adjustments to stay-at-home Sundays. More in this HTS News report.
The first installment of Confinement Sundays has been met with mixed reviews from members of the public who spoke to our news desk. Now, the opposition United Workers' Party is questioning the legality of the new protocol adjustments in the absence of a state of emergency. Ex-Prime Minister Alan Chasney, in a Facebook post, claims, quote, "We call on the Prime Minister to immediately reinstate the state of emergency, as the current protocols restricting people's movement and freedom of assembly are illegal and ultravise the Constitution. A failure to do will force the United Workers' Party to take action in the interest of safeguarding our democracy and preserving law and order in St. Lucia. Unquote. Minister for Health Moses Moussa Baptiste says the measures outlined by the government are aimed at hitting moving targets.
When we think about activities, we think about going to church, we think about going to school, we think about going to the restaurant, going to the beach. All of these activities will have to be taken on board. But the government has a responsibility to ensure that the society as a whole is protected. So yes, you will find in the protocols from time to time what people may determine relaxation. Some people may determine that because it's church, people need to go to church, others want to go to the beach. But we will have to decide as a society how we deal with this.
It should be noted that the current SLP administration's legal footing is based on legislation pushed through the upper and lower house by the UWP administration in 2020. The COVID-19 Prevention and Control Bill controversially passed the upper house, with questions raised about whether there was a quorum to facilitate the sitting. Despite the UWP's present-day protestations, Jean-Baptiste says the government remains focused on the management of the fourth wave of the pandemic.
Internationally, the spread of COVID-19 among children in England is fueling a recent rise in cases nationally and causing concern among some scientists that vaccines are being rolled out in schools too slowly, risking the welfare of children and adults alike. More in this Reuters report.
The spread of COVID-19 among children in England is fueling a rise in cases and concern among scientists that vaccines are being rolled out too slowly in schools. Mixed messaging about shots for children, a later start and inflexibility with the rollout have combined to make vaccination for 12 to 15-year-olds lag behind other European countries, scientists say. Cases in Britain, on the whole, are higher. A survey late last week suggested prevalence was at its highest level since January, with 8% of secondary school kids infected. Lawrence Young, a virologist at the University of Warwick, warns that could risk the health of young and old alike.
And I think the other concern, of course, at the background of all of this is this the possibility of a perfect storm over the winter, because we've got flu. We know we want flu vaccines to be rolled out in youngsters as well, and for the first time, that's all the way up to the 16-year-olds as well. With other respiratory virus infections, with all of what that means, not only again for schools, but also for overwhelming the NHS. So I think if you add that into the mix, then the worry is that autumn-winter is going to get very, very messy.
The goal was to offer all eligible children vaccination shots by the school half-term break, which starts next week. Data released on Thursday showed that 28.8% of children aged 12 to 17 had received a COVID-19 shot. Part of the issue is that kids get their vaccines through schools, which has led to an uneven rollout. The government is considering allowing them access to walk-in centres in the next few weeks.
The World Health Organization is celebrating the International Day Against Breast Cancer. In remote areas, access to healthcare is a struggle. And in West Africa, in the far north of Togo, women with breast cancer are often abandoned by their husbands. More in this France 24 report.
In the extremely isolated region of Kutamaku in the far north of Togo, access to healthcare is very limited. Nyoto has been suffering from breast cancer for about 10 years. She was diagnosed shortly after getting married. When Nyoto was diagnosed with advanced breast cancer, her husband immediately sent her back to her parents. Back home, with her parents who care for her, Nyoto doesn't work when she's in pain. To help her, Nyoto's parents pay for her treatment provided by a traditional healer in a neighbouring village. They can't afford her hospital fees nor her prescription drugs. In the north of Togo, where almost 8 out of 10 people live in poverty, formal healthcare remains inaccessible not only financially but geographically too. Getting to a hospital that treats cancer requires travelling at least 500 kilometres to Lomé, the Togolese capital.
And now for the weather. Present weather is fair skies. Winds are a light breeze of 4 miles per hour from the north. Seas are not exceeding 1.2 meters or 4 feet. Weather forecast for St. Kitts and Nevis today will be mostly sunny at first, then becoming mostly cloudy with a 60% or moderate chance of localized afternoon showers. Tonight will be mostly clear. Sunset today will be at 5:47 p.m. and sunrise tomorrow at 6:05 a.m. And that brings us to the end of the ZIZ Midday Newscast. Join us this evening for these stories and more in detail. Thank you for tuning in. I'm your presenter, Shani Carvey.